So I'm so excited to be talking about how neck, shoulder pain, and headaches are all related. You may only have neck pain. You may only have shoulder pain. Maybe you have neck pain and shoulder pain, or neck pain and headaches. But they are all connected in some way, and so that's what we're going to be talking about. And then make sure you stay to the end to learn some quick fixes, some of our favorite exercises that we're doing. But we're going to go into more depth of just MRIs and injections and like why all these things don't work, as well as surgeries. But a little bit about me. I have been a physical therapist for over 20 years, almost 25 years. Have done talks in a lot of different groups. I've written books about pain and all the different ways that we feel pain and how we can get resolution. We have clients that fly in all over the place to come in and see us because we've been able to help them. So a little bit, make sure you stay to the end. For those that are live, we have a special bonus offer for you. So, what are we going to talk about? We're going to go into why pain pills and medications and injections and surgeries do not work. We're going to go into 3 tips that you can implement today to reduce your pain, some of our top things that we share with our clients. We're going to get into why MRIs and imaging leads us down to more unnecessary procedures, why massages don't always help. They're great. We love massages, but when the pain just returns within hours or within a day, that just tells you that there's something else that's going on that's causing the pain to return. So the actual tissue tightness is a symptom. So what do most of our healthcare providers miss in treating this area? And then why arthritis, rotator cuff tears, shoulder impingements are not your problem or the source of your pain. And then we're going to get a little bit about regenerative therapy and shockwave therapy and PMF, some new technology that we have in our office that's amazing. So, talking about like the cost, let's go into just the cost of like it's expensive, like neck pain, back pain. It's a $34 billion business. The average cost of one injection is $1,200. The average cost of MRI is $1,500. If you get PRP injection, that's $500, $2,500. Stem cells that people are getting $8,000 to $10,000. The cost of surgery, just a fusion alone, is $100,000. This is a costly path to go down, and we're gonna basically try to teach you what you can do to avoid this at all possible. So healthcare costs have risen over 50% in the last 10 years. And our goal is to help reduce that spend, not go be in the doctor's office, not go into doing injections or MRIs if you don't need it. So they also say early intervention with a specialized PT reduces your cost by 50 to 60%. And it's true. They've shown this with like research on physical therapy that's done very specifically to what we do. We're a McKinsey based therapy office. And so they've been shown to reduce when people just come through a PT's office that understands the body like we do, we're able to reduce the cost because we're able to avoid the surgeries and the MRIs and the injections, which are all costly. Getting an MRI first, you are 8 times more likely to have surgery, which is crazy to me. 8 times more likely to have surgery. And it's true. When you look at the research on MRIs, it's horrible. You can have like 100 people with no pain, and 60 to 80% of them are going to show something, whether it's a rotator cuff tear, a meniscal tear, a arthritis, a herniated disc, whatever. Like 60 to 80% of people show something, but they're fully functional, pain free. I mean, they have research with like baseball players. 90% of baseball players, these are pitchers that throw the ball really fast, over 100 miles an hour. 90% of them have rotator cuff tears, but they're fully functional. So when you start hurting and you get an MRI, is that something that is there, that's already there, or is it something that is really, truly hurting? And when you get to someone that understands the body, they're going to be able to help you with that. Save your money on an MRI, spend it on someone that actually understands the body. The U.S. performs more orthopedic surgeries per capita than nearly any other developed country. It's just crazy to me. It's just crazy. So what are some of the causes of neck and shoulder pain and headaches? So our first thing is mobility. We want to look at what how does the body move? How does your upper neck move? How does your middle neck move? How does your lower neck move? How does your thoracic spine move? They all move differently. So the neck and the shoulder is a little bit more complicated than like the back and the hip because there's so many different sources that like so many different ways that the body moves in those areas that we have to look at it all. If something is not moving, you will have muscle protection. You will have issues that goes into the shoulder because all the muscles attach in those areas that also attach into the shoulder, that also attach into the neck to give you headaches. Repeated movement habits also create problems. So we have people that like we had a client that just came in and had TMJ issues for the past week, horrible TMJ, but been dealing with neck pain for 3 years. And we literally, like, we're talking with her, and she was like, "Yeah, my computer screen's off to the right." And I'm like, "Yeah, that's a problem. We need to get it back to the center." She goes, "Yep, I realized it was a problem. I moved it back to the center because it definitely was hurting me." But those are the repeated habits that you're doing. Your body doesn't like being in positions that it's not in its normal resting position. And if you do it 8 hours a day, day after day, you're going to have problems within that joint. Muscle tightness between the shoulder blade is usually a symptom, which is why massages don't always work. You have to look at like what's not moving, especially in the neck and into that thoracic spine. So those are things that we have to look at. Difficulty raising your arm fully, pain down the side of the arm is possibly a spine, a neck, or thoracic issue. So we have to look at all. I think it's like 43.7% of extremity pain comes from the spine. We have to rule it out. And that's a big piece that's being missed. And there's many surgeries that should never happen. So we're going to get into headaches just really quickly. Mechanical headaches are those things that something is not moving correctly in the neck or even the thoracic spine. Guys, the thoracic spine creates headaches at times. We have seen it. It's something that is missed and not looked at. Migraines are things that are more way more there's way more tension. Usually you're light sensitive, you have some visual changes. You got to look for triggers that cause them, and mechanical issues often can trigger migraines. So when we have people that have come in with migraines, we've been able to reduce them because of the mechanics of how they move. We can make that better so that that doesn't trigger it. Different foods and different things like that can also trigger migraines, so you're really looking at that as well. Vascular constriction causing headaches. So your vessels that are in your brain actually clamp down where the blood flow isn't able to get through, which then causes those throbbing headaches. So how we know that something's vascular is we can ask them different questions like, do you like to go outside and exercise, and what? How are your headaches then? Well, they're non-existent then. But when I stop doing it, then they come back again. So when you exercise, it actually opens up the vessels. If you ask them questions like, are there certain foods that you've noticed that will give you more headaches? And like, yes, when I drink milk or whatever, I notice I get more headaches. That's because it inflames that area, and it'll cause constriction. So when you have vascular issues, we're looking at changing your diet. What are some of the triggers? Getting rid of gluten, getting rid of dairy. Those are big triggers that can trigger things like this. Eating berries a vasodilator. So you can do things like that to help those vascular constrictions. Red flags, those are, when you have headaches with nausea, throwing up, unrelenting pain that's worsening, these are red flags for us. We are sending you away to get some help because there's something else that is going on that needs to be looked at. So when we look at like how everything works, so we have ribs through here, we have our shoulder blade, and then we have our shoulder off to the side. So a big component of things that we look at is within the ribs. If the ribs aren't moving, your shoulder blade has to, like when I raise my arm up, the shoulder blade has to come down and those ribs have to go in. If they don't go in, then the shoulder blade hangs out to the side, causing the shoulder to be more rounded. And when that happens, that can create you can get rotator cuff tears from rubbing. You can get labral tears from rubbing. You can get bicep tendonitis, pain down the front of the arm. All those are really common, but it actually is a thoracic spine issue, and we need to resolve that. We literally have had patients that came in, and I was like, yeah, that's a shoulder issue. It's more of like your ribs are causing your problems. And they were like, no, I'm just going to go ahead and have the rotator cuff surgery. And I'm like, okay, I'm just going to tell you, like, if you don't fix this problem, it will come back. got a call from that patient a year ago, a year later, and he said, "Yep, it came back." And I'm like, "Yep, I'm not surprised. It's because you're not fixing the problem, which is your ribs and how your shoulder moves along through there." The neck is also, I mean, we usually rule out the neck before we go. I usually go neck, then thoracic spine. Neck causes a lot of things. And if you look at this, you can see kind of like how all the muscles are interconnected. So things that connect down low will connect up high. So you'll have like stuff up in here to give you headaches. All of these go in and start connecting out into the shoulder and through here. And there, it's why it's all connected. So if something's not moving and it's tightening, it's going to affect other areas of the body, and we have to look at all of that. And so that's really when we're looking at just the body in itself, we're looking at the whole thing and how everything moves. So, why medications and injections don't work? So, we feel pain in different ways. And we're not going to talk about thermal pain. Thermal pain is like burns and sunburns. We're going to talk about mechanical pain and chemical pain. So, mechanical pain is how the body moves. How does the joints move? How does the muscles move? And if any of those aren't doing well, that's the mechanics of how we move. We've got to address the mechanics with mechanical pain. Chemical pain will be constant pain. It is constant aching, throbbing pain. No matter what you do, you can't change the position to make it better and worse. So I'll give you a great example. You could have a kidney infection, constant throbbing, aching pain. You can use chemicals to address the chemicals. But if you don't fix why the kidney is infected, you're not fixing the problem. Think of that as like the mechanics. So a lot of times, most everything that's going on is a lot of it's mechanical pain. If you can change your position, making it better and worse, if you pain comes and goes, these are all mechanical pain. Do not go and get drugs for something like that. It will not work. You're wasting your money and you're wasting your time. Other ways we feel pain is autoimmune and emotional. Autoimmune, we talked about this a little bit at the very beginning. If you were on the call about COVID, creates some autoimmune symptoms. Well, autoimmune will create symptoms. And when you have an autoimmune type symptoms, there's no patterns. We can't recreate your pain. There's nothing that we can do that changes anything. And so when we start noticing this and we start asking questions like, are you noticing that you're getting bloated? And are you noticing that certain foods are affecting you? Maybe you're not sleeping as well at night. Those are common things that come together. Not always, but they are common things. And so we start talking about autoimmune. And we get people to a naturopath that we use in North Carolina because he does a fantastic job in helping get the body back into balance. So that's kind of autoimmune. Emotional is like there's something emotionally happening that's creating your pain, and we can find these out too because we can basically go and improve all the mechanics of how everything is moving. They feel great. We can't recreate their pain in the office anymore, but they still have pain and at times. And so we start asking like, well, when is your pain coming? Well, like, when does it happen? Well, every day when I go to work. And I'm like, what's going on at work? And they're like, well, it's just really stressful and all this. I'm like, you've got to deal with this because that's what's creating your pain. So you need to rewire your brain to think of it differently. Like, no, work is fine. I can handle this. I'm only going to be able to do what I can do. So that you can rewire that. Another thing that people will do will be like, they'll go out of town and they will basically have no pain whatsoever when they're out of town, but they come back in town, and as soon as they come back in town, their pain happens. That's emotional. There's something they need to get addressed, and we also have places we send people for that as well. So this is a client who had 10 years of headaches. Doctors didn't believe her. Nothing was helping. She just kind of gave up until she saw one of our newspaper ads and decided to come in. I always think it's funny because she calls me the good witch. And she wasn't really sure. I just remember this like it was yesterday. And her husband's like, well, are they quacks? And she's like, no, no, I actually think they can help me. And so here's a little bit about her story.
Yeah, absolutely. So my headache started, I guess, maybe right after I graduated from college and had this job. And so they were constant. They were on my head. They just didn't wasn't normal. So I went to the doctor. What you do? And I was told, well, you're stressed. Don't be stressed. And I was like, look, I have a really chill life. I'm not stressed. I wanted to tell you though, oh, I'll take these pills. I grew up in a take a pill, you take a pill. So fine. The problem was, and it never worked. So you go to a different doctor and you have the same story, get the same result. And eventually you just kind of stop talking to the doctor because
You
it's,
kind of give up. You're like, I guess this is the
you
way I'm
know,
going to live.
yeah, I guess this is just my new reality.
Yeah.
But so it was very disconcerting, which was 100 night and day from when you and I, my headaches, because I said, Stephanie, I have a headache all the time. I have a headache that's sometimes tolerable and sometimes intolerable, but they're all, when I told a doctor that, he told me to stop exaggerating.
Oh my
And when
God.
I told you that, you did two really important things that I'm grateful for. One, you said, I believe you. I think that you probably do have headaches. Two, I understand that there's an emotional and physical component to being in pain all the time. And I it. And I was like, someone sees me.
Yeah.
And three, and the most important thing I think is you said, this is not uncommon, but I can help you.
Yeah.
And I went, hmm, let's
Let's see if you can help me.
let's see. Yes, absolutely.
And like 30 minutes and we kind of work on her and she hasn't had a headache in like 3 years, which has been amazing, amazing for her. So, why surgery leads to frustrations? It's because a lot of times we're just treating symptoms of stuff. So, there's so many things that you can do to avoid it. But when someone comes in and does like subacromial decompression of the shoulder, like that's usually when they're not sure what it is, and we're just going to have a surgery. That's usually there's usually a neck component we found when people have those type of surgeries. I haven't seen that type of surgery in a while, but honestly, we don't get people coming in with surgeries at our office. They're usually coming in trying to avoid surgery, or they've had some surgeries that didn't work. Neck surgery, same kind of thing. Like you can go and do like a discectomy and those kind of things. But if you don't understand what you're doing and what started it to begin with, you're going to have that surgery again, and it's just going to lead to fusions. It's very common. One spine surgery often leads to a second and a third spine surgery. Rotator cuff surgery, we've gone and talked about those as well, and even labral tears. If you're not sure what you did to create your pain, there's usually those cases, I would say 95% of the time, do not need surgery. So our evaluation process is just different. It's unique. We always want to ask why, like why is it happening? Trying to get to the source. Our first step is to sit down and ask questions to help us understand your situation and how the injury presents in different situations. So, like, what happens if you're sitting, and how does it feel if you're walking, and what happens when you're lying down, and if you're driving and turning, like, do you know that, like, we're just asking different situations so we can see the patterns that happens. It gives us ideas of where we need to start. Then we get baseline movements. So we move the neck, the shoulder, the thoracic spine. We look at inhibited patterns. And so what does that mean? That means like we find there's weaknesses that happen with the spine. They also happen with the shoulder, and they also happen with the wrist. And so things that with the spine, wrist extensors and external rotators are the big two that like it's one of the big indicators that there's something going on in the spine. And so we can go and do spine mobs, and those will come back like that. Like they'll get strength like that. And so with the shoulder, it's only external rotation. So if we know that there's wrist extension involved and there's a lot of weakness there, we know that the spine is definitely involved. And now there could be a shoulder component, but we'll know as we move you and into different neck positions and start repeatedly moving you and then retesting the baselines. If the wrist extensors get better and the external rotators get better, then we know it's all coming from the neck. If the external rotators don't, we know there could potentially be a shoulder component. So again, these are just things that we look at. We rule out the spine, we do repeated movements, we retest the baselines, and your body will guide us. Whether it gets better, it stays the same, or it gets worse, it all gives us information to know what to do next. We do a lot of manual work, and then we teach you how to maintain what we just did. So here's another person, another client who the doctors made multiple doctors wanted to do thumb surgery on her, and in reality, it was a neck issue. And she had had neck pain for years. No one asked her because I was like, okay, tell me the history and neck pain for years. Started going down to the elbow and then to the thumb. I'm like, I bet this is just coming from the neck, and it was. And so let's check out her story.
Actually, all this pain started about 3 years ago. So I've been dealing with this for a while. I mean, it's been a long time. It all started like back on my neck, shoulder going down. I did go see my family doctor, and of course, they want to put you on medication, muscle relaxers, and all that kind of stuff. That does not help at all.
Yeah.
Besides that, I tried some home remedies, and I did go to, massage people to do some massages and see if that would help. And then, even just medication, and none of that would help at all. The pain will go for a little bit, it will go away a little bit, but it will come right back. And I was dealing with this every day. And then it just got worse down through the elbow. It would numb my elbow completely if I would just stay still for a couple of minutes. Um, Again, 3 years until about a year ago, I experienced my right thumb just getting locked. Um, Went to the doctor again, did x-rays on my elbow and thumb. Nothing's wrong, but you do need to go see a surgeon. They want to refer me to a surgeon to do surgery, which nobody wants that, because
No.
the last thing you want to do is surgery. So got talking to my sister, and she said, why don't you just try physical therapy? And I'm like, physical therapy? I already did chiropractic too, like that's not gonna work. I already tried so many things. You get tired, and you just
Yeah.
like, am I gonna live like this for the rest of my
Yeah.
life? And so I tried it. I am so happy that I tried it. I'm not gonna lie, I didn't really think it was gonna help me at all. People do, just like, you try so many things, you just
Yeah.
don't know
Yeah.
that's gonna work. But I am so happy that I went to go see you, Stephanie, and your other staff that are so good too. And my thumb, I mean, it is just crazy that I can move it with pain. I mean, I do.
And once we got it to stick and stay, we actually had to work on some soft tissue mobs to improve to improve like the mobility of the thumb, but it all went away and she did not even have to have surgery. So here's some exercises. These are ones that we give out all the time. They're neck retractions. This really works. All like it hits all the different areas of our spine a little bit differently. It's kind of the first phase of things. You can do these standing up, lying down. We can do them on our stomach. They all present a little bit different, and everyone's a little bit different in what they need. But how I describe them, it works. When I say this, it's kind of funny. But if you're looking kind of straight ahead, it's like if someone's coming for a kiss, you're like, no. That's the exact motion that you do. And so you just bring the chin in and you go out, do 8 to 10 of them every couple of hours. You can take some baselines of like just moving your neck and just kind of see, move your shoulder, do some neck retractions, and then retest those baselines. And you'll notice like, oh, wow, this is better. This is not better. But it's the beginning phases of what we start to give people to understand kind of what's going on. Another one is thoracic extensions. So again, holding these, do them a couple times a day, holding about 3 minutes. Use a towel roll, just roll up a towel, and then you lie over it. And when you hit areas that are like tight, and you'll know because you're like, oh wow, I can barely move. Yep, that's the area that we want to put it under, and you just kind of hang out through there, and this starts giving you a little bit of some rib mobilization. So these two exercises are fantastic. The last one's posture. So if you look, a phone is a big one. We're always looking straight down. And so what do? You can bring the phone up and you can actually read it with your head looking in a much better position. You can, same thing with sitting in the computer. People slouch and their head will go forward. You can use a lumbar roll in the back to kind of hold your spine in a better position, which then will help hold your neck in a better position. So these are all things that we have to look at Positioning and postures are big ones because if you're again going into something like if you hold your finger back and you hold it back 8 hours a day, day after day, no matter what you do, you can do massage, injections, you can do strengthening, you can do joint mobilizations. If you continue to hold your finger back, you're going to continue to have problems within that joint. And so that's where the posture and positioning comes into play that we have to start giving game plans around that. So, our new equipment, just love it. It's called Shockwave therapy. We are one of only 4 people in the DFW area that has this, which is the Focus Shockwave. That's the one that really can go deep into bone. It can go through a knee joint, it can go through a hip joint. But the Focus is what a lot of people don't have. We have that. Radial is what people do have a lot of. And so, essentially, Focus uses the high energy sound waves. It's very pin targeted. So it's like a pin going through something. So this one, we basically find the spots and just hang out there and let it do its thing and starting the healing. It produces stem cells, collagen synthesis, and it does bone healing. And this treats the pathology. Radial shockwave is more broad. It doesn't go as deep. And so we will use that through our tissue, mostly soft tissue type stuff. You're going to use this with your tendons, your muscles, degenerative tissue, injuries, muscle tissue, muscle injuries. This is where this will help. So when you have scarring, adhesions, calcifications, degenerative, this is like when the body has stopped healing. It literally will revascularize that area and make it new again. So all that will go away pretty quickly. When you have things like an injury, like you have a calf strain, it basically will speed up the healing. So we know it speeds up healing by like 50%. We have an 82% success rate with this when we do our evaluation and understand kind of what's going on and where the source is coming from. And if this is something that you need, we have a good success rate with this. But it heals 50% faster because think of like when you have an ankle sprain, you get all the nutrients that go into that area to start healing that area. Every time we do shockwave, it's like hitting the nutrients again and again and again and again. So it'll really speed everything up without actually doing damage. Stimulates stem cells, increases that microcirculation. It'll like actually revascularize those areas that don't have it anymore. Works on bone, muscle, tendon, ligaments, reduces tendon stiffness. We literally have someone that their toes are curled because their tendon is so tight. We've been able to stretch the tendons out. Now the bone on part of it is a little tight in the toe because it's been bent for so long, but we're showing her how to stretch that joint and her toes are starting to lie flat, which is pretty fantastic. We use the radial focus with our PMF, and when we do all 3, it's magic. And we'll go into the PMF here in a second. So what it does, reduces inflammation, removes damage, it repairs the area, it revascularizes, neovascularizes, it revascularizes those areas, and it will strengthen the tensile strength, collagen synthesis. It just makes the tissue stronger. So these are all the things that it does. Most of the time, I'm just going to be honest with the neck. We don't really use it that often. You can't use focus too low because focus goes so deep. It can actually puncture a lung. So we don't want that, but you can use radial. We have used focus for people who have weird head like symptoms, and we've had some success on reducing like the nerve irritation. And we have used radial on a lot of those areas. But honestly, a lot of times, even in the neck, we are usually pretty successful at just doing some physical therapy. So most of the evidence on tendon and bone, Achilles, it works really well. Plantar fasciitis, patella tendon, trochanteric pain, shoulder and elbow pain, muscle and ligaments, chronic or acute. So muscle tears, degenerative tissue, ankle sprains, recovery from sport, lower back SI joint. We've had a lot of success with some SI joint. If we do thoracic and cervical, usually mostly we use radial. Osteoarthritis, knees, hips, ankles, fingers, it does an amazing job. So this is a little bit about the PMF. So we have the Beamer, which helps increase the circulation by 30%. That means you get 30% more blood flow, nutrients. You're able to detox the body much better. A lot of times that microcirculation gets slower because of injuries, because of aging, all those things. And this will actually help speed it up.
there's no vascular movements or oscillations occurring with the arteriole on the left side, which should be. In addition, there's restricted blood flow, there's poor perfusion, and diminished venous return. Too much of this going on, and you're going to feel tired, you're going to feel sluggish, maybe even experiencing cold hands, cold feet. But one thing's for sure, poor blood flow can be the precursor to many issues that people experience every day, and they don't even know it. Let's take a look here at what happens to the Beamer after it was only turned on for 3 minutes of treatment. You'll already start to see this increase in blood flow. You can see the capillary open up. There's an increased arterial flow. And what you can also see is this increased venular flow, returning carbon dioxide back to the lungs and clearing out the waste products from our body. Here we are after 6 minutes of Beamer use. I want you to pay special attention to the right side, to this venule where the white blood cells are rolling over the endothelial walls of the vascular lumen. Think of it. It's like the cops or the police being out on the streets patrolling and protecting you. That's your mobile immune system. When your blood is flowing, when it's moving, your immune system is more vital. If your blood is not functionally flowing, you can't possibly have a high functioning immune system. Therefore, you're not protected. You can think about it this way. If you're perfused, you're protected. Now we're going to take a look at, and we're going to see the lingering effects of Beamer after only 22 minutes. So Beamer was already done for 8 minutes, 22 minutes after application. So 30 minutes after starting therapy, the effects of Beamer therapy, while temporary, have been documented to last up to 18 hours for some users. Sometimes more, sometimes less. But the fact is, Beamer is an incredible tool to support your local circulation.
Together, it does a fantastic job. So again, for us, for the most part, when we are doing our evaluation, regardless if people are wanting to come in for Shockwave or not, we do a screen for quick wins. And what does that mean? We can get things like if we're noticing that we're moving you and you're improving in your range of motion pretty quickly, we're going to stick with doing that. We're going to get faster results doing something like that. But if we go and we're noticing that, gosh, this is just so stiff and it's just like scarred down, or there's just like, we can tell when there's just degenerative changes, those kind of things, we'll often recommend doing Shockwave. And we've had times where like we have a patient that came in, looked like it was maybe a back issue, having bilateral knee pain, difficulty walking, maybe some stenosis potentially. Although we don't, I mean, usually we can get people where they're moving pretty good. Well, ruled out the back because we couldn't get that. I mean, got some changes, but not a lot of changes. Started going after the hip, couldn't really figure it out. Finally, we realized on that right side, we started doing some distraction and some rotation just to see. He so limited in internal rotation, could not move. And as soon as we tried stretching him into that direction, he was like, all my pain went away. And I'm like, up, there it is. This is the problem. So then we were able to do Shockwave to reduce that stiffness because it's so scarred down. The joint wasn't moving very well. We're able to like start working on getting that joint to start moving better, faster. And this particular client was coming in walking with a walker and is now walking without a walker, which is pretty fantastic. Sometimes after Shockwave, you're definitely going to need some therapy. Some people don't need therapy. Like they can do Shockwave and they're like, this is really good. Just continue to work on strengthening and you're going to be good to go. Other times they still need to work on some therapy. So it's really on a case by case basis on whether something like that happens. But Shockwave, if we're like, yeah, this is the direction that you should go, it's going to speed up the process and the healing so much faster. So what do other healthcare providers miss? Lifestyle changes and posture habits. Like if we don't fix those things that you're doing throughout the day, you're going to continue to hurt. We've got to have a game plan around that. And we do. Only looking at the pain, the side of the pain. So again, you're only looking at the shoulder, but when in reality, it could be a neck issue. This happens all the time. We look at the whole body to see like, are we missing anything? Only looking at the injury one way, for example, like only doing a massage, only looking at the soft tissue piece, or only doing strengthening. A lot of times you go to other physical therapy And that's all they do is they only do strengthening. Doctors only do injections. Do they even have the right body part? Oftentimes they don't, because it's really looking at everything. We really help you put the pieces of the puzzle together. So when you go down these paths like this, it makes you feel like you're on a hamster wheel and you're just going around like, oh my God, I don't feel like I'm getting anywhere and I just want some answers. And you can hear that in like the people that are sharing their testimonials. That's what they felt like. It's like, I'm trying all these things and it's not working. And so no one really puts the pieces of the puzzle together. And that's really what we specialize in. So again, what do you take from this? Most injuries do not require surgery or medications, especially when you're not sure what you did. If you're not sure what you did, a lot those often do not need surgery. I'm talking high percentage. So we've saved a lot of people from having neck and shoulder surgery. Most of the time, no one gets to the source of the problem on why it's happening. MRIs and x-rays don't help in guiding treatment and resolving neck pain or shoulder pain. Really, save your money, give it to someone that actually is going to help you come up with a game plan and figuring that out. See a specialist to help you figure out where the source is coming from. And then there is hope. We just want to give you hope that you can get back to living life again without doing and get back to doing the things that you love, because it's possible. We see it all the time in our office. So here is one more client who literally went to 5, 6 different type of healthcare providers and was not finding any solution for his shoulder pain. And he kind of shares about like his experience at our office.
Yeah, so I was a Division I student athlete throughout college. So I always loved going to the gym and getting a lot of energy out. It was always something I really looked forward to doing. Right when I graduated college, I was always in the gym pretty much once a day, 5 days a week, 6 days a week. And after about a year and a half of doing that, it caught up with me. And the routine bench press, I was hitting pretty often. The overhead press, I was hitting really often and not focusing on a lot of what you guys later found out was my scapular weakening that I had going on, really caught up with me and wound up causing a lot of shoulder pain to the point where I couldn't actually do any bench press or really lift anything across my body, overhead, nothing like that, for about a year and a half.
Oh gosh. So tell us a little bit about, I'm sure you went to the doctors. What were some of the things that they said?
Yeah, over that period of time, once again, being a student athlete for so many years, I was really used to, oh, something's wrong, just call a physical therapist, find the first one you can find, and usually they can figure it out for you. So I had tried probably about 5 different professionals before I finally found my way to you guys. Everything from a physical therapist to a chiropractor to a massage therapist, and tried a few of each, I would say, before I eventually found Empower.
Yeah. So what was it that they did that was maybe like, how are we different compared to them and the way we approached everything?
I would say the first thing was you guys did a really holistic check of all of my mechanics. I would oftentimes walk into other offices and it felt like they had 15, 30, maybe 45 minutes if I was lucky to see me, and I was in and out, and it was very methodical. It wasn't really too in-depth.
Yeah.
Wasn't a very deep overview. When I went to you guys, just for the first initial consultation, I remember walking in and I believe you and Natalie were sitting right there. And you said, just by the way I was walking, you could already pinpoint exactly what was wrong with me, just by the way I was sitting with my posture.
Yeah.
So it was extremely night and day experience between you guys and them, because then you did a whole holistic check and found truly the root of the issue that, once again, after a year and a half, I finally got a lot of relief from that pain.
Yeah, what a lot of people don't realize is when people have shoulder pain, you have to look in the spine. You have to look and see how things are moving in your neck, how things are moving in your thoracic spine, because they're all connected. And if something's not moving, then you just have that compensation pattern. But the first thing people want to go to is, oh, it's just a weakness thing. Oh, it's just a soft tissue thing. But they're not getting into like, well, why is it weak? Why is the soft tissue like this? And if you don't get to that, then you just aren't going to solve anything. And a lot of people don't even go into looking at that as a shoulder issue. I mean, we literally have a client that decided not to go and see us, and the doctors convinced them to have rotator cuff surgery. Had the surgery. This is an athlete. Had the surgery, and came back and told us, like it called like it's been like a year and a half. He goes, my same pain's back and I have another tear. And I'm like, yeah, like I was saying before, no one's getting into what you're doing and why it's happening. And I saw you for that first visit. You were not moving. I said, please don't have the surgery. But the doctors, they're like, your arm's going to fall off and you're going to die if you don't have the surgery. We can sit down and do a discovery visit with one of our specialists to really get an understanding of kind of what's going on with your health. If you book today, here's the QR code. If you book the DV today, we will give you $150 off the evaluation. And actually, if you just tell us after this that, yes, I want to do a DV, I'll put you on the list. We'll call you in the morning. You can also text our office that you want a DV and we'll get you that $150 off the evaluation. Even if you don't go into the evaluation, or like it's always up to you. But it's there for you. If you decide, yes, this is where I want to go, this is what I want to do, you'll get that off. If you decide to wait for a DV, that's totally fine as well. We'll give you $50 off your evaluation on it. We have a list of everyone that's come in watching this today. So anyway, that is everything, and we will stop the recording and go to the questions.